It's Thursday, November 19. This is the news on PBCJ. I'm Carol Francis. Over 45,000 acres of former sugar lands in St. Catherine and Clarendon are to be rationalized. The Sugar Company of Jamaica is accepting applications from entrepreneurs to put them into profitable production. One area that is being looked at is dairy farming. In the late 1980s and early 1990s, Jamaica produced approximately 40 million liters of liquid milk. In 2000, that figure was below 15 million liters, a decline of over 50%. Marlon Samuels has more on Jamaica's dairy industry and what's being done to improve it.
In the 1990s, Jamaica's dairy industry was severely impacted by a number of factors, including poor nutrition of dairy animals, poor farming practices, and trade policies that opened the door to the importation of cheap milk powder. There is no use crying over spilt milk. Instead, the government is on a drive to boost local production of milk. This would result in a twofold benefit. Jamaica could meet the need for milk locally while reducing the country's food import bill. In 2016, a number of stakeholders joined forces and launched the Drink Real Milk campaign to inject new life into the dairy industry.
It was an initiative from the Nutrimix brand, which is under Newport Mills Company, which is a part of the larger CB group. And we had some partners come on board with us. We had Seprod come on board because, of course, through Surge, they're the largest milk producer in the Caribbean. We had Newport First San. They are experts in fertilizers, and of course, with dairy farms, you have to get your pastures up. It's not just about having good dairy feed like what we make at Nutrimix, but of course, the pastures need to equally be excellent. And then of course the Jamaica Dairy Development Board, they also came on board with the campaign because it is what they're about. This campaign we are hoping will be a 10-year campaign, just because dairy, to move production and consumption in dairy, is going to take a long time. It's not a short-term initiative, and everyone who has signed on thus far, they are all in it for the long haul, which is very encouraging, not just to us, but to the farmers as well. So a lot of the dairy farmers who are already in it were investing more in their farms. Some who had come out of the industry were coming back in, and we had new people. The workshops that we do are essential to the farmers. So what we did with Nutrimix is we went into the smaller clusters all across the country, and we took the farmers, sometimes 3 or 4 farmers at a time, sometimes 15, 20, 30 farmers at a time. And we held these workshops to help bring them back up to speed on the best practices for dairy farming and also the new technologies available. And we didn't just stop there. What we tried to do is elevate the industry standards here by bringing in breeds, different breeds, to upgrade the stock, the livestock that's here in Jamaica.
The Seprod Dairies factory in Bogwalk, St. Catherine, has reportedly been expanded to meet the demand for milk-based products. Based on projects, it appears the sky is the limit for farmers, old and young, to milk the dairy industry and earn a profitable income. For the news on PBCJ, I am Marlon Samuels.
Expungement is having a conviction removed from one criminal or police record after a specific period of time and after certain requirements have been met. Here in Jamaica, expungement is guided by the Criminal Records Rehabilitation of Offenders Act of 1988. However, under our current laws, offenses including the trafficking of narcotics such as cocaine and marijuana, murder, rape, and arson cannot be expunged. Speaking at a recent JIS think tank, Justice Minister Delroy Chuck says that the list of offenses that can be expunged can be broadened.
I must admit, I favor a broad expungement so that anyone, and for all offenses, that's my position, who has demonstrated that they have put crime behind them They have served their time in jail. It could be 10, 15, 20 years in jail. And for the next 10, 15 years, they have demonstrated that they're going straight. They have no further convictions. My position is, why shouldn't the expungement committee be able to look and see how has this person behaved in the community? And should they now grant an expungement?
The minister cited an example to support his argument.
There's a pastor who was convicted for murder, and it was reduced to manslaughter. And he served, to the best of my knowledge, 10 years, having been 10 years in prison. He came from prison and has been a pastor, to the best of my recollection, close to 30 years. And he's asking for it to be expunged. Manslaughter can't be expunged. And the question I ask myself, and the expungement committee that is chaired by a bishop, why shouldn't this man be allowed? He's now in his 70s. Why shouldn't we allow him, to have his offense expunged?
Hundreds of frontline healthcare workers continue to grapple with the COVID-19 pandemic affecting the island. Here now are the latest figures.
The island's COVID-19 death toll jumped to 235 on Wednesday after 2 more fatalities were recorded. The latest mortalities are a 53-year-old female from Kingston and St. Andrew and a 63-year-old male also from Kingston and St. Andrew. 69 new cases were registered over the past 24 hours, bringing the overall total to 10,088. There are now 4,306 active cases. 38 recoveries were also recorded, bringing the number of recovered cases to 5,407. At this time, there are 8 moderately ill and 7 critically ill patients. 91 persons are now in hospital. For the news on PBCJ, I'm Gabrielle Thompson.
November 19 is International Men's Day. Locally, the theme is "A Man's Health is a Man's Wealth, Men and Healthy Lifestyle Practices During This Pandemic." Minister of Culture, Gender, Entertainment and Sports Olivia Grange preempted the day's activities with an address to her male colleagues in Parliament this week.
A round of applause for the nation's leading men from their female counterparts in Parliament on Tuesday.
We celebrate fatherhood, paternal bonds, and the efforts of male parents towards their family and our society. It is important to recall and recognize the endless efforts, initiatives, and contributions of our Jamaican men and boys.
International Men's Day is celebrated on November 19 each year and is marked in 80 countries worldwide. Minister of Culture, Gender, Entertainment and Sport Olivia Grange says it's a day to focus on men's health, improving gender relations and highlighting positive male role models.
To celebrate men's positive contributions to society, to community, to family, to marriage, to childcare, and to the environment. 3, to focus on men's health and well-being, social, emotional support, physical and spiritual. 4, to highlight discrimination against men, because men at times are discriminated against. Discrimination in areas of social services, social attitudes and expectations, and law. 5, to improve gender relations and promote gender equality. And 6, to create a safer, better world where people can live free from harm and to grow to reach their full potential.
The day is being marked by a forum and presentation of Outstanding Father Award at the Jamaica Pegasus Hotel in New Kingston. the soft launch of the exemplary male role models 2021 calendar, and a rap session being chaired by State Minister in the ministry, Alanda Terrelong, via Instagram and Facebook platforms to speak on a range of topics including men's health and other psychosocial issues. For the news on PBCJ, I'm Simone Absalom.
The government is working to minimize the impact of tobacco consumption. That's the word from Minister of Health and Wellness, Dr. Christopher Tufton. It's part of a push to minimize the impact of non-communicable diseases and substance abuse on the Jamaican society. Presently, smoking is banned for indoor public places, indoor workplaces, and public transport.
We'll be tabling, hopefully during the course of this year, certainly the course of the financial year, our alcohol policy, a green paper, once approved by Parliament, which will seek to address over time a national discussion around alcohol and consumption and what are the best practices for prevention. We will be advocating for labeling because we do believe that consumers have a right to know what they're consuming. And that is a discussion that has started. We in public health will take that on and become advocates for that particular cause in partnership with others as part of baseline studies to determine how much sugars and how much salt is contained within our diet as part of getting consumers to know and the consequences of that, as well as to encourage manufacturers to reformulate to support better products, healthier products.
Dr. Tufton says plans are afoot to establish an NCD task force.
We're in the process now in collaboration with one entity at UWI, Professor Henry, to complete our trans fat studies to look at the empirical evidence around baseline and the presence of trans fats within our foods. There's also going to be emphasis on breastfeeding or the breastfeeding policy as a means of prevention for childhood obesity and establishing good nutritional base for our children.
There is opportunity in crisis. That sentiment was shared by Health and Wellness Minister Dr. Christopher Tufton about the COVID-19 pandemic and some of the doors it has opened. The view was expressed at the signing of a multi-million-dollar pilot program with 4 private health facilities. They will provide primary care to non-COVID-19 clients with diabetes and hypertension. Simone Absalom has more in this report.
Minister of Health and Wellness Dr. Christopher Tufton says the nation's public health sector has been focused on infection prevention and control during this COVID-19 pandemic. He says managing the pandemic has required significant learning and adjustment because it's a new virus.
The last 9 months has seen experiences that we have never experienced in our lifetime. And it has caused us or called upon us to be creative, to be innovative, to abandon traditional norms, cultural norms, and to experience in the process, in a sense, what could be described as almost a revolution in the way we know life and the way we have had to adjust in some radical ways to this new norm.
Dr. Tufton says the impact of COVID-19 can be seen in all spheres of life, and the Health Ministry has sought to reassure the public that the health sector is resilient and flexible.
In a sense, even with the challenges of COVID, what the COVID experience has done for us is forced us to recreate ourselves. And in a sense, there's opportunities in that. There is a silver lining if you look for it, rather than to be dismayed and to resign yourself to those negative consequences. So for us, the opportunities are there, and it is for us to advance those opportunities out of thought and out of innovation. And the public health system has responded to that as a national priority.
This week's signing of a public-private partnership with private medical practices is one innovation that gives the Health Ministry the opportunity to focus on critical illnesses.
I've always believed in partnerships because I don't believe in public health any one man is an island. We have to work together.
The Health and Wellness Minister notes that the pandemic has shown the need to respond to the fundamental challenges being faced in public health.
We have to bring back the focus to the non-communicable disease conversation. It is essential and it cannot be ignored because, frankly speaking, the greatest pandemic that we face, and indeed the world faces, is one termed as the non-communicable disease pandemic. Simpler put, for understanding, we say it's a lifestyle disease. It's how we live within our environment, our consumption habits, not knowing our health status, not doing physical activity or sufficient physical activity.
The latest public-private partnership with private practices follows that of the Adopt a Clinic initiative, which has garnered widespread support, with Jamaicans based locally and in the diaspora committing $81.4 million to the cause. For the news on PBCJ, I'm Simone Absalom.
Gas and diesel prices are up this week. For this and other market movement details, we join Gabrielle Thompson for the Business Report.
According to the latest ex-refinery costs from Petrojam, motorists should see an increase at the pumps in the prices of gasoline and diesel effective Thursday, November 19. Following an increase of $1.44 each, 87 and 90 octane gasoline will be sold for $106.15 and $108.98 per liter, respectively. Automotive diesel fuel saw an increase of $1.39 and will be sold for $108.93 per liter, while ultra-low sulfur diesel is up by 83 cents and will be sold for $111.11 per liter. Kerosene saw a price increase of 23 cents and will be sold for $82.63 per liter. Propane liquid petroleum will be sold for $46.62 per liter, down by 20 cents, and butane liquid petroleum will be sold for $51.85 per liter after an increase of 31 cents. Marketing companies and retailers will add their respective markup to these prices. In Wednesday's trading session, the JSE combined index advanced by 5,586 points to close at under 400,000 units. Overall market activity resulted from trading in 82 stocks, of which 30 advanced, 40 declined, and 12 traded firm. The junior market index declined by 19 points to close at under 3,000 units. Stocks advanced for Access Financial Services, CAC 2009.5% preference shares, and Caribbean Cement Company Limited. Stocks declined for 1834 Investments Limited, AMG Packaging and Paper Company, and Barita Investments. Trading firm were 138 Student Living Variable Preference, Berger Paints, and Cargo Handlers Limited. Grace Kennedy Limited was the volume leader with 4.7 million units, followed by Trans-Jamaican Highway Limited with 3.2 million units and NCB Financial Group Limited with 2.7 million units. Now for the foreign exchange. The US dollar on Wednesday, November 18, ended trading at $147.83. The Canadian dollar sold for an average $112.62. The pound sterling traded for $196.35, and the euro ended trading at $178.94. Oil prices dipped on Thursday as a surge in coronavirus cases and tighter economic restrictions around the globe weighed on fuel demand expectations, also dragging down equities globally. Brent crude futures were down 27 cents to $44.07 a barrel. West Texas Intermediate crude futures slipped 43 cents to settle at $41.39 a barrel. And that does it for this edition of the Business Report on PBCJ. I'm Gabrielle Thompson.
Situated in the heart of Kingston is a charming hotel called City View. It prides itself on its ambience, delicious food, and exceptional service. You can feast on a delicious wedding breakfast or traditional Jamaican meals made only with the finest fresh and locally sourced ingredients. That's where the Culinary Trail team journeyed.
This was built as a dream home, my wife and myself. And we had planned, we started building it in our 30s. It was completed when we were about, 41, completed. And the plan was to sell it about the age we are now. Because we don't want a big house when we, get old. The house, the property was our major asset. We didn't want to sell it. So we conceptualized a business from it. And at the time we said, well, Jamaicans overseas will always want to come home. So we conceptualized a kind of a home away from home, target market, Jamaicans overseas, and naturally, for want of a better word, the local market would be also. So happy to say that is now working. That is now working. Other is weddings. I remember when I just came home, I used to go down to Manchester, where I'm from, almost every Sunday. And driving on Mandela Highway, there used to be a cluster of bougainvilleas. And persons used to go there taking pictures after weddings. So the idea came to me driving one Sunday. I said, a venue for wedding at City View. In fact, it wasn't known as City View at the time. And then I said, Jamaican food is renowned globally. Renowned globally. So I said, a Jamaican restaurant with a difference. Turn Bob Marley into jazz, so to speak. Create something from what we have. Yeah? And I said, we have some of the finest entertainers in the world and the influence we have musically in the world. So I said, a venue for wedding, a home away from home for persons, a restaurant with Jamaican cuisine, creating from what we have, and entertainment, live entertainment. I must say this without any apology. Without my wife, this could never have happened. Never have happened. In every negative, there's a positive. And I'm seeing all the positive in this COVID. City View Hotel is not a venue that persons can just drive off the street and go and sit in a car park and whatever. All right, so we're full out of people every day. You only come to City View Hotel if you're doing business. So you can't just drive in. So it's a private, it's secluded, In the daytime, you come to City View Hotel, you feel a sense of tranquility. And it's a fact. All right? The first time that I personally ever experienced ambiance is when we had the first event here at City View Hotel. The ambiance, there's an ambiance. So these are facts. If you want action and whatever, it's not City View. It's a romantic, secluded wedding venue. City View is ready. We have the staff, we have the venue, We have all the amenities.
In news across the region, disciplinary action will be taken against police officers in St. Lucia who failed to wear masks in public. We have more in this report.
No one is above the law, and that goes for law enforcement. The police force is charged with ensuring adherence to COVID-19 protocols, which include wearing of masks. But Deputy Police Commissioner Milton Daisy says officers will not escape accountability for failing to cover their faces when venturing outdoors. His remarks come after a police officer in Trinidad was arrested and issued a ticket for breaching COVID-19 protocols by not covering his nose and mouth in public.
The police on patrol may see an officer who is at the same rank with him, and based on our standing orders, you would need to be of a rank above that individual where you have to report them and so. But we have the system in place where the officer could report to the commissioner of police that X person is not wearing mask, and we could take disciplinary action against those individuals.
Daisy urged officers to practice what they preach.
We have seen an increase in police officers wearing their mask in and out of uniform, and I think they need to continue doing it to set the example, because if we cannot be going out there asking persons to wear your mask, keep your distance, and then we are doing the same. So if persons choose to do the same, they will be treated, as I said, they'll be treated as the ordinary person.
The deputy top cop has given orders that officers wear face coverings on and off duty.
The commissioner has sent out instructions that police officers, whether in uniform or out of uniform, has to wear their mask.
According to Section 21.1 of the COVID-19 Prevention and Control Act, persons must wear masks or suitable coverings for the nose and mouth when in public. Additionally, the Act also mandates that people distance themselves from others. Failure to comply could lead to a maximum penalty of $1,000 or 6 months in prison, or both. Colby DeVoe, HDS News Force.
Supporters of a former medical intern have turned their eyes to the Medical Board of Trinidad and Tobago as they await a decision following an investigation into racist comments made against the intern by a doctor. The supporters delivered letters to several government officials calling for legislation to be developed to address racism in the country. They are also calling for the doctor's license to be revoked. Kimberly D'Souza has the details.
I'm standing here in front of a small protest for Dr. Delia Gabriel, the young doctor who was released for controversial statements that she made back in 2018. Now another doctor made controversial statements, and his license is also on the line. But as the supporters will tell you, they are now calling for justice.
How come the medical board so silent on this doctor? And I was surprised when I heard a former Minister of Health, who was also a member of the Medical Board of Trinidad and Tobago, Dr. Khan, when he said the medical board cannot revoke Dr. Saw's license, and if they revoke his license, he could sue the medical board. But Dr. Khan was silent in 2018 when a young doctor who was 3 weeks to complete an internship was dismissed.
That young doctor is Dr. Delia Gabriel, who believes there's a template in place to address racist comments by medical practitioners, as her matter was brought before the High Court and her provisional license was revoked. Although she issued apologies, she is still unable to practice today. But Ms. Gabriel says if Dr. Sao is remorseful and is willing to hire persons of all races, she has no problem working for him to continue training as a doctor.
I need a job. Honestly, I can find work anywhere despite dropping all my titles and dropping all my professional qualifications. Even then, I don't know if they blacklisted me. So that was the only reason why that I reached out to Dr. So, because he appeared to be reflective and more inclusive.
She says Dr. Sao has not responded to her request. Kimberly D'Souza, TTT News.
In sports, according to International Olympic Committee President Thomas Bach, it will not be mandatory for athletes attending the 2021 Tokyo Games to be vaccinated, but he urged them to do so as it's a demonstration of solidarity with the Japanese people. Therefore, Caribbean athletes heading to the Olympic Games in Japan next year can skip getting COVID-19 vaccinations. The IOC president made the announcement during a visit to the athletes' village on Tuesday before concluding his two-day trip to Tokyo with a visit to the National Stadium.
In 9 months from now, we know that we will even have more COVID countermeasures in our toolbox than we have now.
The Games were postponed in March this year owing to the COVID-19 pandemic. More than 11,000 athletes are expected in Tokyo for the Olympics, scheduled to start July 23, 2021. Thousands more will arrive for the subsequent Paralympics. And that's our package. Join us again tomorrow for more news and sports right here on PBCJ, the People's Station.